Knock knock.
Come in.
Hi there, my name is Michael. I'm a registered nurse here. How are you doing today?
Good, how are you?
Good. Can I please get your first and last name and your date of birth?
Javier Ramirez, 0714-1993.
Alrighty, can I please check your wristband? Alright, great. So I'm a registered nurse here today. We're going to be doing a head to toe assessment. So I'm basically assessing your physical features and body functions.
Okay.
It's going to take about 15 to 20 minutes. You have enough time for that?
Yes.
Alright, we're going to be using a deep tendon hammer, tongue blade, otoscope, pen light, and a stethoscope.
Okay.
Do I have permission to touch you?
Yes.
Alrighty, we're going to go ahead and start, alright?
Okay.
So taking a look at your head is normal cephalic. There's no signs of microcephaly or hydrocephaly. No masses, lesions, or nodules present. We're going to take a look at the hair. Your hair is black in color, evenly distributed, coarse, and dull. Any pain or tenderness upon palpation?
No.
And I'm going to take a look at the back of the nape. No signs of pediculi or parasites. And no signs of patchiness or alopecia. I'm now taking a look at your face. No involuntary movements or tics. Facial features are bilaterally symmetrical. Your eyebrows are black in color, bilaterally symmetrical, and evenly distributed. Taking a look now at the eyelashes, the patient's eyelashes are evenly distributed, black in color. Upper eyelashes curl upwards and bottom eyelashes curl downward. Taking a look now at your external eye structures, your eyelids are free of ptosis, no signs of any infection, nodules, lesions, or masses. The outer canthus of the eye is lined up with the pinna of the ear, and now pulling down the conjunctiva of the eye, we see that conjunctiva is pink in color, moist, no signs of infection, nodules, lesions, or masses. Sclera is white. The cornea of the eye is free of any cloudiness, and the iris is brown in color and consistent throughout. Now I'm going to do a quick test for your fields of vision. Go ahead and follow my pen light with just your eyes, don't move your head. Patient was able to follow all 6 cardinal fields of gaze without any signs of nystagmus. Go ahead and look forward for me. Corneal light reflex is symmetrical in both eyes. Now I'm going to check for constriction and dilation. Shining a light in the right eye constricts. Taking it off, shining it in the right, the left eye also constricts. Now we're going to test for accommodation. Go ahead and look at that point for me. And now once you see my pen light moving, go ahead and look at it. Eyes converge upon the pen light, there is accommodation, and there is the pupils constricted. We're now going to move on to the ears. Let me know if you feel any pain or tenderness. Upper auricle, tragus. Any signs of pain or tenderness here?
No.
No signs of mid-ear infection and mastoid process. Pain or tenderness?
No.
Alrighty. Now I'm going to take my otoscope, put the batteries in. We're going to flip it upside down. We're going to grab the patient's ear, pull it back and up. We take a look inside. Patient's ear has normal amounts of cerumen, pink in color, no signs of nodules, lesions, or masses. The tympanic membrane is pearly gray, no signs of perforation, and the shape is convex. Now we're going to do a whisper test. What I'm going to have you do is cover your left ear, and I'm going to whisper a word. Go ahead and repeat it back to me, okay? Apex.
Apex.
Patient has a negative whisper test, meaning that cranial nerve 8 is intact. Now I'm going to assess your cranial nerve 7. Go ahead and wrinkle your forehead. Raise your eyebrows. Smile. Smile with teeth. Frown. Purse your lips. And whistle. Cranial nerve 7 is intact. I am now going to check your nose. There's no signs of any nodules, lesions, or masses. I'm going to palpate the area around it. Any pain or tenderness?
No.
Good. Go ahead and look up at the ceiling for me. The nasal mucosa is pink in color, moist. No signs of any nodules, lesions, or masses. The septum is midline, no deviation, and no perforations in the septum. Go ahead and cover one nostril and breathe in for me. And the other. Nasal passageways are clear. Taking a look at your lips, it's free of any crusting, pink in color. No nodules, lesions, or masses. Go ahead and open your mouth for me real quick. Oral mucosa is pink in color, no nodules, lesions, or masses. We're now going to take a look with the tongue blade right here. When I tell you to, say, okay. All right, open your mouth and say ah.
Ah.
Uvula retracts. Tonsils are not visible, so they are rated at a +1. Cranial nerve 10 is intact. Now we're going to move on to the. Actually, let me assess the range of motion of your neck real quick. Go ahead and look up for me. Look down. Side. Look side. Look to the side. Ear to shoulder. And ear to shoulder. Thank you. Now let me assess the strength of your shoulders. Go ahead and shrug for me. Good. And turn your hand against my neck. Strength of 5 out of 5 for shoulders and neck. Now we're going to move on to the upper extremities right here. We see that the color is consistent throughout. There is a tan line up here. Taking a look, there's no nodules, lesions, or masses. Taking a look at the hands, the nails are pink in color, smooth, free of any splitting or ridges. Capillary refill is under 2 seconds for each finger, and there is no skin tenting. Skin turgor is good. I'm not going to assess the strength of your arms. Go ahead. Actually, the range of motion of your arms first. Go ahead and have your arms straight up. Flex. Bring them out again. And now, can you pull against me? Strength of 5 out of 5. Push against me. Strength of 5 out of 5. Now we're going to move on to the wrist and hands. Can you go ahead and make this shape? Close it. Inward. Outward. Straight again. Open your fingers. Close your fingers. And now squeeze both of my fingers. Good. Now can you lift your hand up like that? Strength of 5 out of 5. And push downward. Strength of 5 out of 5. Hand strength is also 5 out of 5. Now we're going to assess your fine motor functions. Can you touch your thumb to your fingers in a rhythmic motion? Patient has fine motor functions, be able to do it in a rhythmic motion. Now we're going to test. Can you please touch your hand to your nose? Alternate in a rhythmic motion as well. Good. Now touch your nose and then touch my finger. Good. And now can you please flip your hands over and under on your lap? Patient has fine motor skills in the upper extremities. We're now going to take a look at the patient's thorax. Can you take your shirt off for me? Thank you. So we see that the chest rises and falls with patient's breathing. There is no use of accessory muscles and there is no intercostal retraction with breathing. Color is consistent throughout. The patient's neck muscles are toned. I'm going to palpate from the back. We're going to check your trachea. Trachea is midline. There's no signs of deviation. From here, I'm going to assess your back. The shoulders are squared with the hips. Patient's back has a muscular build. Color is consistent throughout. No nodules, lesions, or masses. I'm going to auscultate for deep breathing, okay? Okay. We're going to start with the apex up here. Go ahead and take a deep breath in. Vesicular breathing. Go ahead and take a deep breath in. Deep breath in. Deep breath in. Bronchovesicular breathing. Deep breath in. Deep breath in. Can you cross your arms in front of me, please? Can you hug yourself? Thank you. Deep breath in. 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 And lastly, deep breath in. We've assessed the 10 points on the back. The breathing is clear and consistent throughout. There is no signs of any adventitious sounds such as rhonchi, wheezing, or crackling. We're now going to check the lateral breathing. Can you go ahead and have your arms in front of you like this for me? And what we're going to do is we're going to auscultate and rotate and alternate back and forth between the two. We're going to start on the right side. Go ahead and take a deep breath in for me. Deep breath in. 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 And last one, deep breath in. Assessing all 7 points on the lateral thorax, we hear no crackling, wheezing, or rhonchi, no adventitious sounds. Breathing sounds are heard clearly and consistent throughout. We're now going to move on to the anterior. Deep breath in for me. Deep breath in. 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 All right, moving on to the base. Deep breath in. And deep breath in. Patient's breathing sounds were heard clearly, no signs of any adventitious sounds such as wheezing, crackling, or rhonchi. We're now going to move on to heart auscultation. So I'm going to first inspect. I see that your chest, there's no signs of any pulsations. No signs of pulsations. We're going to check your apical pulse for 1 full minute. Apical pulse is an 84, normal rate and rhythm, strength of 2+. I'm going to check your respirations real quick. Can you please put your hands over your chest? Respirations are 16 per minute. With apical pulse 84, I'm going to compare it to your brachioradial pulse as well. We're going to check that bilaterally. Checking the brachioradial pulse bilaterally, we see that the pulse is an 84 as well, normal rate and rhythm. And yeah, bilaterally symmetrical. We're ready to auscultate the heart sounds now. We're going to first start using the diaphragm of our stethoscope. We're going to start at second intercostal right sternal border. S1 and S2 sounds are heard. S2 is louder than S1. No S3, S4 sounds. We move over to the left sternal border, second intercostal. S1, S2 sounds are heard. No, S2 is louder than S1. No S3, S4 sounds. Moving down to Erb's point, third intercostal right sternal border. S1 and S2 sounds are heard. No S3, S4. No gallops, heaves, thrills. Fourth intercostal left sternal border, that is the tricuspid. S1, S2 sounds are heard. S1 is louder than S2. No gallops, S3, S4 sounds, heaves or thrills. Fifth intercostal midclavicular line. This is the mitral valve. S1 and S2 sounds are heard. S1 is louder than S2. No S3, S4 sounds. We're now going to repeat that same order using the bell of the stethoscope. Aortic. S1 is louder than S1. S2 sounds are heard. S2 is louder than S1. No S3, S4. Pulmonic. S2 is louder than S1. No S3, S4 sounds. Erb's point, third intercostal. S1 and S2 sounds are heard. No S3, S4. Fourth intercostal, tricuspid. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4 sounds. Mitral. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4. Auscultation of the heart is complete. We're going to move on to the abdomen. Can I please have you lay down, and I'm going to raise the bed up. We're going to split the abdomen into 4 quadrants at the umbilicus, vertically and horizontally. We're going to start with auscultation, but first we take a look at the abdomen. Color is consistent throughout, no signs of bowel distension. We're going to take a listen now using the diaphragm of our stethoscope, starting at the right lower quadrant. We hear normal peristalsis sounds, high-pitched gurgling sounds, intervals of 5 to 30 seconds, no signs of hyperactive sounds. Right upper quadrant, high-pitched gurgling sounds, intervals of 5 to 30 seconds, no signs of hyperactive sounds. Left upper quadrant, high-pitched gurgling sounds every 5 to 30 seconds, no signs of hyperactive sounds. Right lower quadrant, high-pitched gurgling sounds every 5 to 30 seconds, no signs of hyperactive sounds or Borborygmus sounds. We're now going to move on to percussion. We're going to percuss in the same order, starting with the right lower quadrant. We're going to percuss 2 to 3 areas. Tympanic, right upper quadrant. Tympanic with the dull spot where the liver is. Tympanic. Tympanic. Left upper quadrant, left lower quadrant. We're now going to do a light palpation on this area. Any pain or tenderness?
No.
Right lower quadrant, right upper quadrant, any pain or tenderness?
No.
Left upper quadrant, any pain or tenderness?
No.
Left lower quadrant, any pain or tenderness?
Oh.
Now we're going to do a deep palpation without raising our hand. Any pain or tenderness in the right lower quadrant?
No.
Right upper quadrant, pain or tenderness?
No.
Left upper quadrant, pain or tenderness?
No.
Left lower quadrant, pain or tenderness?
No.
No signs of enlarged organs, no pain or tenderness, meaning no signs of pancreatitis. We're now going to move on to the lower extremities. Color is consistent throughout, no signs of erythema or edema. We check the tibia, there's no signs of edema here. We look at the patient's feet, no signs of stress ulcers or lesions, no masses, nodules, or lesions throughout the leg. We take a look at the feet, we see that the toenails are pink in color. There is a sliver missing right here on the toenail. Other than that, no splitting or ridges. We're going to check capillary refill. Capillary refill is under 2 seconds. Now I'm going to check your dorsal pedal pulses. Dorsal pedal pulse has a normal rate and rhythm, symmetrically bilateral, strength of 3+. We're going to check your posterior tibial pulse now. Posterior tibial pulse has a strength of 2+, normal rate and rhythm, symmetrically bilateral. I'm now going to check the fine motor functions of your feet. Go ahead and tap your feet quick for me. All right, can you draw the figure 8 in the air? And lastly, can you run your foot down your opposite shin, both sides? Patient is able to do fine motor functions with the feet and legs. Can you go ahead and sit up for me? Before we have you get up, we're going to check your deep tendon reflex. Go ahead and scoot back a little bit so your legs are dangling. All right, we're going to go down, check the patella, go a little bit further down, and I'm going to strike it right here. Patient has a 2+ for the deep tendon reflex. I'm going to go ahead and lower the bed all the way. Can you please stand up for me? Alrighty. Can you please look that way? We're taking a look at the back. The shoulders are in line with the hips. Go ahead and bend forward for me. Touch your toes. Back is bilaterally symmetrical. We're going to palpate the spine. Spine is midline. No signs of scoliosis, lordosis, or kyphosis. Go ahead and stand back up. We're now going to check for range of motion. Go ahead and lean back. Lean forward. To the side. Other side. Now rotate just your upper body, left and right. Patient has full range of motion of the back. Alrighty, now I'm going to assess your gait. So go ahead and stand back here, and I'm going to have you walk forward. Patient has normal gait, normal arm swinging in tandem. No signs of hesitancy. Alright, now go ahead and walk heel to toe. Patient's able to walk heel to toe, no signs of balance loss. Go ahead and walk back. Next, I'm going to have you stand in one spot with your eyes closed, heels together. Slight swing, negative Romberg test. Now I'm going to have you lift one leg up. Patient is able to stand on one leg with eyes closed. Go ahead and go down, and now hop on one foot. Alrighty, patient is able to hop on one foot. Excellent proprietary and cerebellar function. Alright, we're done with the physical assessment. You go ahead and put your shirt back on. I'm going to go ahead and gather these materials and go document your findings. Thank you for your time. I'm going to go document your physical assessment. Go ahead and wait here, and the doctor's going to be in with you.
Thank you.
Alright, thank you. See you, Professor Dev.